This Wednesday is brought to you by Jaganathan Neurosurgery.
We're sitting down with Dr. Kramer from Jaganathan Neurosurgery. Now, doctor, you handle a very specific kind of spine surgery called arthroscopic. Did I say that right?
Correct.
Now, what is arthroscopic spine surgery?
So the advantage is instead of doing an open midline incision where a lot of tissues opened up and exposed, I'm able to do spine surgery and zero in on the pathology using a very small round tube. Now, this is advantageous not just because of a smaller incision, but there's actually less tissue disruption, less blood loss, less unnecessary tissue manipulation. And this enables me to do almost all of the spine surgeries on an outpatient basis, meaning you get a go home day of surgery. And nowadays, that's a huge advantage, right? You're not stuck in the hospital, running up a bill or exposed to other germs like COVID or staph. And this is huge because patients are able to start mobilizing right away and avoid, complications such as like blood clots and pneumonia. So, this has been a paradigm shift in spine surgery.
First thing that popped in my head was the healing process after the surgery takes place. I am an outpatient. We have come that far. That's remarkably impressive. Now, tell us a little bit about your work at Jaganathan. What type of clients do you see in need of this specific kind of surgery?
Most of our patients have disrupted quality of life due to pain. Some may have numbness, tingling, and weakness also, but let's be honest, most of the patients are frustrated that they've had years of pain and they're gaining weight and depressed and aren't able to do the kinds of things that they love. And some of them are just fearful that they might fall. And they, desperately want to kind of enjoy life again. And so, a lot of our patients are more the geriatric age patients, so 60, 70, even 80 years old. These days, no one's willing to just give up and, sit in a recliner and watch Hallmark movies. I mean, everybody kind of wants to hopefully, get back to being active and walking. It's just a lot of fun for me to help intervene in their life and restore their health and quality of life.
Which, on that note, Dr. Kramer, you could be doing anything with your time and dedication. What about this is important to you? What keeps you coming back every day outside of course, really changing a lot of lives for the better? That's got to be incredibly rewarding.
It is. I mean, right, it's sort of the supreme responsibility for patients to trust me enough to allow me to potentially intervene in their life. It's let's be honest, it's a life-changing decision to undergo surgery, and that's really scary for most people. And this is something I've done my whole life. I'm at the top of my game. I've been doing this for 24 years. And so I've gotten good at reading patients and walking them through the process and holding their hand through the surgery and the recovery. So I really enjoy that, taking a surgery that's oftentimes scary and breaking that down and getting patients excited to know that there's a minimally invasive option that may restore their health. And that's exciting.
Just the thought, I'm assuming years in pain, years of not being as mobile as you're used to, just getting back to normal, something that those of us in good health take for granted, life altering. Now, doctor, if you could, in our last couple minutes together, I'd love to hear a story of someone that came in, thought that they were maybe, never going to be able to find help. You were able to help them. Could you share with us maybe a story that touched you personally, sir?
Sure. I guess one patient that comes to mind was somebody that was not of good health to begin with, and I think probably started to judge herself quite a bit, and started to wonder if something was wrong with her other than just a spinal problem, like maybe yeah, maybe she wasn't the best candidate for surgery because she had too much weight, for instance, and maybe she was shamed into believing that that somehow it was her problem, that she was still struggling with pain. And how do you lose weight when you can't walk? How do you lose weight when you're in pain? I mean, this is a very difficult spot. And with arthroscopic spine surgery, it doesn't matter how big or skinny a patient is; it's just a longer tube. I'm using the microscope and operating through a tube the size of your index finger. So it's brilliant. So I'm able to even help patients out traditionally in whom traditional surgery wasn't an option. So this particular patient was obese and yet still had a pinched nerve and wasn't able to get help or get better on her own. So as a result of surgery, with the pain reduced, she was able to get back active, and she was so grateful to be at that level again. And she was just a raving fan, and so that was exciting to see for sure.
That's You're doing some really, really rewarding work, Dr. Kramer. Now, if our viewers at home, they're listening to this and it is absolutely piquing their interest, they want to reach out and get in touch to see if they're a good candidate for this surgery, what's the best way they can get more information and reach out to you, sir?
So yeah, they can connect with me online or through the office, and we'll provide that contact information.
Perfect. And as Dr. Kramer just said, we're going to make sure all the links that you need to connect with Dr. Kramer or to reach out to Jaganathan Neurosurgery, it's all going to be available after the show today over on 9and10news.com.
This Wellness Wednesday is brought to you by Jaganathan Neurosurgery.